TZ1 calf mobility strategy. We have an inverted, depends on which way you look at it, but with the right leg as the reference point on the wedge, we have an inverted position. If we're struggling to get eversion, the heel rotating down and in, we'll push ourselves further in the inversion to feed out so that we can create a little bit more eversion. And we will use this feed out strategy progression with some single leg toe touchdown rocker shift patterns. So heel to toe rocker with the right foot, left heel comes off the ground, knee is going to drive straight ahead towards the big toe, so anterior with the reach, knee height to shin. We will, after we've mastered the motion control of it, shift and rotate opposite side or in sync at 45 degrees, and we'll allow the knee to, from the top down, go with this. And our reach, and we'll go opposite side and in sync at 90 degrees with our reach. We'll have a preset anterior medial foot wedge position, which is common for the frontal plane. We are feeding out. We want to create more eversion of the right rear foot, rotation down and in. And we're going to preset it more inverted up and out. And we have a preset anterior medial stepping strategy progression, so a crossover. And we're going to start with our little weight shift forward, knee going towards the big toe, and hands reaching mid shin height to knee height. And we're then going to go in sync, so 45-degree angle reach to the opposite side. And so the strategy of the crossover foot positions really allows the hips to drive, and the combination of that transverse and frontal plane, that anterior lateral motion to control, while allowing us to create a little bit more eversion of that right heel. And then we'll go in sync or opposite side at 90 degrees. With the hips feed out a little bit more, we'll start with a anterior lateral pre-positioning, in which in the frontal plane, foot's down and away, single leg toe touchdown pattern progression, and we're going to use a little rocker step here. Rocker step, so we're going to shift our weight towards this 45-degree angle, right anterior lateral, and then use a little rotation to come on back to anterior. We go in sync, opposite side at 45 degrees. It's a way for us in the transverse plane at the mid-tarsal joint to get a little bit more abduction and then a little bit more eversion of the right heel by coming around the foot and the ankle complex, so to speak. And then we're going to go 90 degrees in sync, or what we refer to as the opposite side. Right knee will come with us as we go in sync to the opposite side.